This is a brief tutorial on how to perform the swallow assessment. When you first encounter a patient, you should do a quick cognitive assessment. The second thing that you should do is to assess the patient's ability to follow one-step commandments. And the third thing that you should do is to perform a quick oral motor examination. For the cognitive assessment, you can briefly introduce yourself and then ask the patients for their names as well as the ability to give their date of birth. You can also test the patient's comprehension by asking simple commandments like closing their eyes or lifting their arms. The next step is to make sure that the patient can follow one-step commandments as well as to sit in an upright position for at least 15 minutes. You can ask the patient to open their mouths, stick out their tongues, as well as to repeatedly say the phrase, ah, ah, ah. During the oral examination stage, you will assess for facial asymmetry when asking the patient to smile, look for choking or coughing when asking the patient to swallow, as well as to assess for a good cough reflex when asking the patient to cough. To perform the swallow test, you will need a teaspoon or a 5 ml syringe as well as a cup of water. Give the patient 5 ml of clean water and observe whether the swallowing is delayed, absent or appears painful. If the patient drools or spills water out of their mouth, they will fail the test. Ask the patient to count from 1 to 10 or alternatively voice ah for 10 seconds. If the voice is clear and no discomfort is observed, give the patient a larger sips of water. After the patient has performed their first swallow, observe for a wet gurgly voice, choking, coughing or throat clearing, increased shortness of breath or the need for suctioning. If any of the symptoms are observed, the patient fails the swallow assessment. The patient should remain NPO and the attending doctor should be notified. The patient should not receive oral medication and regular oral care should still be provided. If the patient passed their swallow test, a soft texture diet should be introduced. The patient should be observed closely during initial meals and they should be rescreened if the status declines. A referral for a swallow assessment should be done if any concerns arise. And that brings us to the end of the swallowing assessment.